Okay, so imagine needing healthcare, but just one huge company, like, controls almost everything. Your insurance, what your doctor decides,
Yeah.
even like how much your meds cost.
Yeah.
Sounds kind of like a Black Mirror episode, right?
Right.
Well, that's basically what we're facing with UnitedHealthcare.
It is. It is.
So today, we're going deep into their story. We're going to explore, like, how they got to be such a healthcare giant. We'll uncover some of their practices. Some are, like, super innovative, but also kind of shady. And examine what all this means for, you, if you're a patient, that is. And the source material for all this. UnitedHealthcare, innovation or exploitation in the fight for better care. Let's get into it.
All right. So the interesting thing here is that UnitedHealthcare is like way more than just an insurance company.
But
they're like woven into how the entire American healthcare system works.
wow.
Yeah.
So they insure over 26 million Americans. That's a lot of responsibility.
It is.
But that's like just the beginning. UnitedHealthcare is actually part of this bigger thing called United Health Group.
Right.
And they also own Optum. Have you heard of Optum?
Yeah, Optum is where things get really interesting.
Okay.
They do data analytics, they run clinics, they even like manage pharmacy benefits. It's almost like they're building a whole separate healthcare world.
So they're not just about like who they insure, but also about how they like deliver the actual care.
Exactly. Yeah. They control a huge network of all these services.
So on the surface, that like integrated system seems like it could make things smoother, maybe even make healthcare cheaper.
Potentially, yeah.
But does all this power in one place also create a system where profits are like more important than patients getting better?
That's a really good question. That's the central question, yeah.
That's what we're going to be talking about today.
Absolutely. So let's look at their innovations. UnitedHealthcare has been like a pioneer in using something called predictive analytics. Imagine if there was a system that could predict which patients are like most likely to develop certain conditions.
It's a Magic 8 Ball for healthcare.
Haha, kind of.
Okay.
It's not about predicting the future exactly, but it does help doctors step in early.
Okay.
Like, let's say it identifies someone who has a high risk for getting diabetes.
Right.
That might lead to them making lifestyle changes that could prevent them from ever getting the disease.
Okay.
They've also been super important in expanding telemedicine.
It's telemedicine.
Especially areas where people don't have easy access to specialists.
Right.
Like, you can think about getting expert advice right from your own home.
It sounds really cool.
Yeah, it is.
Is there a catch?
Well, there's always two sides to every coin.
Mm-hmm.
That same data that can predict and prevent disease can also be used to figure out risks and then adjust people's premiums.
Okay.
Meaning, the same data that identifies someone with a high risk for diabetes could also be used to say, well, now we have to charge them more for their insurance.
So it could actually be used against the patient.
Potentially, yeah. So, is that fair?
Hmm.
That's a huge debate going on right now in the healthcare world.
So it's like this thing that can save lives might also be used to discriminate against the people who need it the most.
Yeah, exactly. That's exactly the complexity we're dealing with here. And then there's OptumRx. It's their pharmacy benefit manager.
Okay.
And they engage in something called spread pricing.
Spread pricing.
In simple terms, they make a profit from the difference between what they pay for the drugs and what they charge the insurance companies.
Oh.
It's like completely legal, but it does raise some ethical questions.
So are they really trying to make care affordable?
Right.
Or are they just trying to like make as much profit as possible?
Exactly. It's a system that's already really expensive.
Yeah.
Yeah. For you, the patient.
Yeah. It's like they're adding another level of cost.
Yeah.
To this system that's already like super complicated and expensive.
Absolutely. And that kind of leads us to the darker side of the UnitedHealthcare story. You hear about denied claims, rejected treatments, and people fighting for the care they need.
Right.
Like, there are so many stories out there of people getting denied coverage for like essential medications or procedures.
Wow.
And it seems like it's just to save the company money.
So is that the cost of being efficient? Like, are we losing patients because they're focused on like just making bigger profits?
Mm-hmm. So one of the craziest cases I read about involved a cancer patient who was denied coverage for a drug.
Wow.
A drug that could potentially save his life.
Wow.
Because UnitedHealthcare said it wasn't medically necessary.
Oh my God.
People were outraged.
I can imagine.
And they did end up reversing their decision.
Okay.
But it does make you think, how many cases are there where something similar happens?
Right.
And people don't have the resources or the energy to fight a system that seems like it's designed to protect money,
Right.
not the patients. It's a scary thought. Yeah.
It really is. And it's not just about controlling patients. UnitedHealthcare, they influence the doctors too.
What?
Remember Optum, the company with all the clinics?
Right.
That means they have a huge say in how doctors actually practice medicine within their network.
So they're not just controlling who gets healthcare, but also how that care is given.
Exactly.
What does that even mean for me as a patient? If my doctor is part of that system.
Well, some doctors have said they feel pressured to not order expensive tests or treatments.
Really?
Even when they think it's best for the patient.
Wow.
So imagine you're a doctor.
Yeah.
You have to choose between what you believe is a doctor and the financial limits of this massive company.
That's an ethical dilemma.
Yeah. And it's something that a lot of healthcare providers are facing.
This is all kind of scary. It feels like this big company is making all the decisions and maybe putting profits ahead of actual patients.
It's a valid concern. It makes you think about the bigger picture. Is this just UnitedHealthcare? Or is all of healthcare becoming more about corporations?
Yeah. UnitedHealthcare's story, it's not unique. It shows a larger trend happening in American healthcare. It's healthcare is less and less about caring for people and more about managing a business.
So is that just how it's going to be?
I mean, is healthcare just going to become all about profit and not about people getting better?
Yeah.
Not necessarily. There are other ways to approach healthcare.
Okay.
Some countries have figured out how to have private insurance, but they also have rules that protect patients.
Okay.
Let's look at Germany.
Okay.
They have a system where everyone has to have health insurance, but they have strong regulations to make sure it's fair and that people can afford it.
It's like car insurance, Everyone has to have car insurance.
Exactly.
But the government makes rules so insurance companies can't just take advantage of drivers.
Exactly. It's the same idea. So they found a way to make sure everyone has coverage. But they don't let insurance companies just do whatever they want.
Yeah. What kinds of regulations?
Yeah.
Well, in Germany, the government sets limits on how much insurance companies can charge for those premiums.
Okay.
And they say, you have to cover these essential healthcare services.
Got it.
And they also regulate the pharmaceutical industry so drug prices don't just skyrocket.
Okay.
It's not perfect, but it shows that there are other options, different ways to do healthcare.
So that brings up a big question. What can we do here in the U.S.? Is there any way to actually make healthcare more about patients and less about the money?
It's complicated, but yeah, there are some things we can try. One big step is more transparency.
Transparency.
Imagine if you could easily compare prices.
Right.
How much does this procedure cost at different places? Or see what your insurance company is paying for your meds.
Right.
That would give patients more power to make good decisions, and it would hold those companies accountable.
It's let's see what's really going on with these healthcare costs.
Exactly.
What else?
We need stronger regulations to keep companies from just taking advantage of the system and choosing profits over patients.
Okay.
Think about safety rules for cars. We don't let companies sell cars that we know are dangerous, even if it would save them money.
Right.
So why should healthcare be any different?
Okay. Yeah. But right now, it seems like these huge healthcare companies, they have so much power, especially with all that lobbying they do. Can we even fight that?
It won't be easy, but it's possible.
Okay.
Some experts are even talking about really big changes.
Like what?
Breaking up those huge healthcare companies or even trying universal healthcare.
Wow.
Those are big ideas that need to be talked about.
It's going against how things are done now.
It is, but it's clear something needs to change. We can't just sit here and accept a system that puts profits first
Right.
and people's health second.
So it's not just about understanding how healthcare works. It's
Wow.
about actually doing something.
Exactly. It's realizing you have power as a patient and as a citizen
Okay.
to demand a better system, one where everyone has access to good care, not just the people who can afford it.
It should be a RAM.
Exactly.
Okay, so we've gone through the whole rise of UnitedHealthcare. We've talked about what they're doing that's good and the stuff that's a little worrying.
Right.
But as we wrap this whole thing up, I keep coming back to one question. What does all this mean for, you, the patient? Just trying to figure out healthcare in America.
Yeah. I mean, UnitedHealthcare's story, it really shows this like tension at the heart of American healthcare.
Okay.
It's this clash between like making money, profit, yes, and the well-being of the patient. And it makes us ask, like, whose values are really shaping the future of healthcare in this country?
And that's a question that goes beyond just UnitedHealthcare.
Right.
It's like the whole system.
Yeah.
And the choices we're making as a society.
It is, yeah. And it's a question that like needs some real honesty
Right.
and critical thinking.
Okay.
Are we okay with a system where profits come first and patients come like second? Or do we want a system that focuses on everyone getting good quality care that they can actually afford?
Right.
These are not easy questions, but they're questions we need to be asking.
Yeah, it's like we're at this like crossroads. On one side, we have all this amazing new stuff in medicine and technology.
Yeah.
But then on the other side, the system's getting so complicated and so expensive, and it's like run by people just trying to make money.
Right. And that is exactly the challenge we face. We have to figure out how to use these innovations without forgetting like the human side of healthcare.
Right.
Like remembering that healthcare isn't just another product.
Right.
It's a fundamental human right.
So what can we do?
Is there even like a way forward to a system that's more fair?
Yeah.
There's no easy answer, but there are steps we can take, like both on our own and together.
Okay.
And it starts with awareness,
Okay.
like understanding the system, seeing the challenges, and being like informed patients.
So the more we know, the better we can fight for ourselves.
Exactly.
And fight for a better system.
Yes. And don't underestimate how powerful your voice is. Talk to people.
Okay.
Tell them your experiences. And contact like the people who represent you in government.
Right.
Let them know that healthcare reform is important.
Yeah, they work for us, right?
Yeah,
They should know what we care about.
exactly. And remember, you're not alone. So many people and organizations are working to make healthcare better. Get involved.
Yeah.
Support their efforts.
Be part of the solution.
Yeah, create a movement.
A push for change.
Exactly. And don't be afraid to think big.
Okay.
Question everything. And imagine a future where healthcare is a right, not a privilege.
It's about all of us, right?
It is.
The healthy society helps everyone. So as we wrap up this deep dive, I feel like a little worried, but also hopeful.
I get that.
You know?
I think that's a fair feeling. The future of American healthcare, it's not set in stone. What we do now, the conversations we're having, they're shaping the future.
So the challenges are big, but like we can do something about it.
Exactly.
We can ask the tough questions, fight for change, and work together to create a system that's actually good for everyone.
It's about remembering that healthcare. It's about people.
Right.
It's about families and communities. It's about that hope of getting better, of living our best lives. And that's something worth fighting for.